Good morning. I am Dr. Gay Carlson, President of the American Academy of Child and Adolescent Psychiatry, with number 21 of our Screenside chats for our AACAP members. Screenside chats, as you may know by now, are meant to share timely clinical practice and other information for our members on key topics that really have to do with COVID and these terribly stressful times. Reminiscent of President Roosevelt's fireside chats during the Great Depression and World War II, I'm hoping that they'll be informative and comforting and address things that have not been otherwise addressed in the materials that are available to you. In recent weeks, we've talked about parenting. We've had a number of people on, Dan Waxbush from Penn, last week, Harold Koplowitz, and today I'm pleased to have Dr. David Rettew with us. David is a child and adolescent psychiatrist and an associate professor of psychiatry and pediatrics at the University of Vermont Larner College of Medicine. He's also medical director of the Child and Adolescent Family Division of the Vermont Department of Mental Health. He writes a blog for Psychology Today called The ABCs of Child Psychiatry that's been viewed over 1 million times. His newest book is Parenting Made Complicated, What Science Really Knows. And it's about the greatest debates of early childhood. Now, while AACAP is not supposed to promote products, it's important for us to inform members about important topics. And Dr. Rettew has really put together some important topics for child and adolescent psychiatrists to know about, to help our parents help their kids. So David, in the opening chapter, you write about how in the process of trying to get this done, you ran into a lot of people who criticized, they were sort of naysayers for you. They said people will never have the bandwidth to read this. They'll be too lazy to read the book. What's the phrase that's being used these days? Too long didn't read, TLDR. Can you talk about that for a bit?
Sure. It's an interesting story, and thank you so much for having me on. I think it's partly because we live in a time now where there are opinions everywhere. They're often very clear, they're decisive, and they're concise, often concise enough to fit on a tweet. And they're often wrong, but that's the culture right now. And in many ways, my book is the antithesis of all of that. It does make conclusions. I try very hard to offer very practical information, but it's non-judgmental, science-based, and it doesn't reduce parenting to a one-size-fits-all enterprise. So, I've been writing for a long time. Authors are used to rejection. If you can't handle rejection, you shouldn't be in the writing business at all, as far as I'm concerned. But as we were trying to find a publisher for the book, a lot of the criticism that I heard back was directed at the reader, in addition to sometimes at me. So what people would say is, yes, it's a good book, it's well written, but people don't want to hear this. People don't want, they want to be told what to do. They don't want to be presented with a lot. They don't have to think too much. They don't want to have a lot of options. And, when I heard that, I got it because of the culture, but to me, I thought it sold people short. And in the end, I got a little annoyed, and it actually made me want to prove to the publishers that there are parents out there, there are, clinicians out there who want more than just a recipe. They want more to be just told what to do, and they're okay with being presented science in a thoughtful way, and they want to make their own decisions and to think things through. So in some ways, it sort of created a new mission for the book, was to show that there is this group out there, and we'll see if that's true. I hope it is.
What you're saying reminds me of one of my professors, mentors many years ago at UCLA, Dr. George Tarjan. I don't imagine you would have known him because you're too young. But anyway, Dr. Tarjan said, the trouble with child psychiatrists is we have too many hands. And I said, what do you mean too many hands? And he says, well, we're always saying on one hand and on the other hand. And so as I read your book, I thought of George, and I thought, yes, this is a book that says on one hand and on the other hand. And so you do need to be able to think. And I can see where you might have gotten some pushback about people, as you say, just saying, tell me what to do. I don't want to have to think.
Well, saying it depends, which is a very common answer that good scientists often say, I can understand it's a very boring and unoperational answer to give. And I think it's a terrible place to end a discussion, but it can be a really good place to begin a discussion. And so I don't try to tell readers, oh, it depends, and then that's it. But to say, well, if your kid is like this, then you might need to go in this direction. Or if your kid is like that, maybe you need to move in a different direction. So we start at it depends. We don't end there.
Yeah. Well, I did notice that. So you might just run down how a chapter will go, because there really was a certain structure to each one of them. So just...
Sure. So in the beginning, I try to offer some general advice and try to help parents understand what their child's temperament is with some tools. But then most of the book, each chapter is devoted to one of these perennial parenting controversies, whether it be sleep training, daycare versus home care, praise, discipline, screens, picky eating. And I first try to summarize what the science really says about this topic currently. And then if the answer is it depends, and obviously it often is, then I try to break it down a little bit and start saying, well, depending on this factor, you might need to move a little bit in the other direction, or alter your approach a little bit based on often child temperament, but other factors as well.
So in fact, for those of us who see patients and so forth, it's actually something that is helpful for the clinician, because we sometimes know, in terms of the kids that we're treating or the families that we're helping with the child, we know what the child's temperament is. We sort of know what the parent's orientation is. So are you suggesting it might also be helpful for the clinician to have, maybe the parent doesn't need a manual, but maybe it's a nice manual for the clinician?
I absolutely do. I learned a ton in the process of writing this book. The book actually came from when I was a child psychiatry fellow, and I was asked a very reasonable question from a parent about sleep training, about whether ferberization would have any negative impact on their child. And at the time, I didn't know what to tell this parent because I wasn't sure what the science was. And now, 20 years later, I might be able to say something to that parent. But yes, I actually think clinicians, pediatricians, child psychiatrists, teachers could learn a lot from the book. And I make this bold claim that I think readers of this book will know more about the science behind these parenting controversies than the average pediatrician or psychiatrist. I've yet to have somebody really challenge that claim, and you looked at the book, so you can tell me if that may be true. But
well, I did notice something to that effect, but it certainly did. There were a lot of things that I thought you must have put a lot of time and effort and research into each of those chapters, because they really were well thought out and well referenced. I do have to tell you, though, David, a number of years ago, I was talking with a mom, and she'd come to me with her child who had these terrible meltdowns, and somebody had said that the child had bipolar disorder, which at that point was really being synonymous with terrible meltdowns. Well, the child really had autism spectrum disorder. He had a seizure disorder. He had a lot of problems with his brain. And so I was trying to explain to the woman what autism was and the kinds of regulation problems you have with that, and if you have seizure disorders, and this is what bipolar disorder has, and I was trying to be as psychoeducational as I could. And she looks around the office, and she looks at all the diplomas on my wall, and she's got a bunch of papers in her hands, and she slams them down on my coffee table, and she says, "Look, Dr. Carlson, I know you have a lot of diplomas. Just tell me, does my child have autism or bipolar disorder?" And so I think that it is an uphill battle sometimes when you've got somebody who wants a final answer. The it depends part may be the part that the clinician has to help them with, because you know what the depends are. The parent may have more trouble thinking that through. I don't know. Have you found that clinically?
Yeah, I've run into that exact same thing, and I certainly appreciate the need to offer real conclusions and real advice. And at the end of every chapter, I actually do my best to sort of put what we know into one little box to really summarize the points for practical use.
So you referred to temperament before. Tell us how temperament works its way into the book, and how it's really an underpinning for the way that you guide parents through the various controversies.
Sure. So temperament is how I actually started my career. I started as a researcher in temperament, and so it's always been a topic that I've been really interested in, and I think is highly relevant to child psychiatrists. So temperament, as many of our listeners know, kind of refers to the building blocks of our personality. They're sort of our core traits, things like extroversion or neuroticism, some of our regulatory abilities. And, I think anybody who's a parent and anyone who's worked with more than one child knows that the same approach can work incredibly well with one kid and then be a spectacular failure with the second. I mean, we know that kids are different. And, why is that? I think one of the big reasons that is the case is that kids are different temperamentally, and that our strategies, maybe they don't have to be completely different, but you have to be able to move a little bit in different directions. I sometimes say that kids are like big mountains, and they can, generate their own weather. And if you really want to sail in those different winds, moving different directions, you need different techniques. So, one example of that might be screens. Screens are a huge topic right now, even before the pandemic. And certainly there are, strong arguments about how they can be useful. There are strong arguments for why they can be hazardous. And I have a chapter on screens, and I go into some of the research behind that. But there may be differences depending on the kid in terms of what the benefits and the hazards of screens are. So, for example, if you have a more anxious child, one of the big dangers of screens is not that they're going to turn into a serial killer, but that screens can scare kids, that you'll actually traumatize a kid by overexposing them to the wrong content. And, a little kid who sees a scene of Jaws isn't going to want to take a bath for a month or something like that. Whereas another kid who may be prone to be aggressive, you may need to worry about kind of the copycat behavior and the desensitization. Whereas another kid who might be more, what I call sort of the mellow type, screens just might be an easy thing for them to do. And it just, there's a displacement effect, and they just want to spend their whole life sitting on a couch and not doing other things that are probably better for their brain. So, when you think about this in temperamental terms, I think you can have a more nuanced and a more comprehensive view of, what limits you should set, how you should set them, and what parameters to go by when you're, trying to navigate this really, really tricky area.
Well, that certainly makes sense, but I'm sitting here, of course, thinking my two boys have grown up now, but they had about as opposite a temperament as you could possibly imagine. My older son was a very volatile kid who wore his feelings on his sleeve, and in a way was easy to parent because you always knew where you stood with him. And my younger one was quieter, more circumspect. When the older one got mad, he flew off the handle like that. When the younger one got mad, he had what I called a snit. He wouldn't talk to you for 6 hours, and he just, gave you dirty looks. So there you are. You've got two kids with two entirely different temperaments. How can you be equal-handed with, well, you get to do this, but you get to do that?
Yeah, some of that gets back to the, that adage that many of us use, that fair doesn't mean equal. And that obviously, I think, can be a hard concept for a lot of kids to understand and appreciate. But nevertheless, I think it's really quite true. And I think as long as you can explain to kids that sometimes that, quote, unfairness is working in their favor as well, I think eventually most kids can get it.
The optimist in you. Okay. So as far as screens are concerned, then you would say Well, so how do you know then how to legislate that? Walk us down the road a little bit. You said the mellow kid shouldn't be allowed to sit on the couch. He has to. He only gets an hour a day, and then he's supposed to go play. And the anxious one, you would desensitize him to watching Jaws. How would you go further with those things?
For screens overall, I think screens is an area that I think screams for moderation. And, it seems like if you look on the internet, you're sort of forced into two camps. And one camp is screens are the root of all evil. It's destroying our generation. It's causing people to shoot schools. And, we should try everything we can do to avoid screens as long as we can to the fullest extent that we can. And then there's the camp saying, hey, this is no big deal. We've always complained about the current generation. We live in a digital age, and your kid's going to be left behind if they don't have some skills in working with screens. And while there are points on both sides, I think we have to, there's also a moderate stance that understands that screens and, the digital age is here, and we need to be able to train kids in those areas. But that there are some real downsides with screens, that they can have an impact on attention, they can have an impact on aggression, they can have an impact on anxiety, and we have to look out for that. And if we start noticing that kids are starting to not be able to do anything but look at screens, or that they're imitating behavior, or they're finding that they're having nightmares, and we have to pay attention to that, and then move in a moderate way to set reasonable limit. So there's some a medium ground here. There's some moderation that I advocate for when it comes to screens, that you have to tweak a little bit based on some of these temperamental characteristics.
So you mentioned discipline in there. That's you touch on that a bit in your book as well, with the you talk about spanking, you talk about timeouts. How would you help out in terms of screens and disciplines, looking at the sort of theoretical framework that you're operating from?
Yeah, so when it comes to discipline, I spend some time just looking at the literature on corporal punishment. And I think a lot of us, especially in many of our areas, think, nobody really uses corporal discipline anymore. But it actually remains a very common practice, and one that's still endorsed by the majority of parents. So I don't think we want to think that we've moved beyond that. And, the bottom line when it comes to corporal punishment is that I really couldn't find any scientific evidence that it either is that particularly effective or that it results in improved behavior down the road. And most of the literature, I think, suggests the opposite, that it can lead to worse aggression, worse relationships, and an inclination to act aggressively when kids get older. But what's been interesting now is that, so what do you do instead? So what a lot of people have used are techniques like timeouts, but now timeouts have become controversial, and there's a camp that says that timeouts can cause biological damage, and that they're abandoning kids, and that you shouldn't use them, and instead that you should be using time-ins when kids misbehave. And I think a lot of parents are kind of confused. They see their kid acting up and like, well, should I do a timeout? Should I do a time in? Is my kid doing this for attention? Are they doing it because they can't regulate? And again, you're forced into this false dichotomy, in my view, of thinking that, well, I either have a kid that misbehaves for attention or because they can't regulate. But the truth is, and it's a little more complex. Sometimes kids misbehave because they want attention. Sometimes they don't. Sometimes you need to use a timeout. Sometimes you probably want to use a time in. And instead of this more sort of political polarization that we find ourselves, what I'm urging is that we have to take a moderate stance, and we have to be able to recognize that kids are different and act like little scientists in the moment, and actually try something, be objective about whether or not that's helping. And if it's not helping, you might need to change direction a little bit and try something different rather than sort of dogmatically following, some religion or, some, point of view that you are supposed to apply universally to every kid in every moment.
Well, I think that's, let's stay with that for a minute, because it sort of touches on something that, as you may know, my AACAP presidential initiative has to do with children who have problems regulating themselves. And they get upset for a variety of different reasons. And you're absolutely right. It really makes a difference if your child is having a meltdown because he or she is terrified, as opposed to they've learned that if they want to get you to give in to them. See, 25 minutes, the last tantrum lasted 25 minutes before Dad buckled. So I guess I better be in here for the long haul, 30-minute tantrum today. That there are some kids that we have managed to shape that way. So you're right. I think people do have to be little scientists. And as clinicians, we need to be able to get parents to do some of those baseline observations in order for us to be able to provide the appropriate advice to them. Do we encourage limit setting? Do we provide, graduated exposure? Do we ignore? Do we, what's the word? Collaboratively problem solve. It really, I completely agree with you. It does. It depends. But the kid isn't, what shall I say? He or she isn't the same way all the time.
So not only do we have to deal with the complexity that different kids are different, but that the same kid might be motivated by different things at different moments. So in one point, they may be acting up because of attention. For another reason, they're very anxious, or they're completely dysregulated, and the techniques that are going to be effective will have to vary. And I think parents can do this. I mean, if you remember when we were, parenting infants, you can often distinguish between, the wet diaper cry and the I'm scared cry and I'm hungry cry. We're not always perfect, and parenting doesn't require perfection. But, if we sort of tune into those types of things, and we can measure our response based on those observations.
Well, that's true, except that some interventions really require consistency. So if you're going to be doing a behavioral intervention, you don't say, well, sometimes you're going to get a timeout and sometimes you're not going to get a timeout. And sometimes when you have a hissy fit, you get your screen back just because I know you've had a bad day in school. And other times, I think you're a pain in the rear end and you're not going to get it. So I think at a certain point, don't you have to fish or cut bait and say, okay, we're going to try this. We have to try it for a significant period of time, sometimes be months. I mean, kids don't necessarily pivot on a dime, but don't you have to pick a thing to do?
That's a great point, and I agree that consistency is very important. But at the same time, there can be moments where a child has really lost it, and and using all the motivational techniques in the world to try to get them to turn around are not going to be effective. And what I think you need more is kind of a co-regulatory response. But you have to be able to have those options. And that's why I think just subscribing to one camp or the other really kind of limits your toolbox in a way that, in the end, kind of limits your options and doesn't give you all the range that you need.
Well, I think one of the things that we've found over the years, right, is that kids are resilient and parents are resilient, and you can make a mistake once or twice or three times, and most of the time you recover. I mean, there may be some mistakes you can't recover from, but, like poisoning or shooting or, a car accident or something like that. But for the most part, I think the things that we do as parents are, you should try to learn from what you did wrong and try again. And I think if kids understand that you understand, it's even a good modeling situation. I don't know if we have time. We're just sort of getting to the end, but I do think the way you divided parents, you talked about kid temperament, but you also talk a little bit about helicopter parenting and tiger parenting and so forth. Just tell us a little bit about that.
Sure. So, there's this there's this vast literature on overall parenting approaches, but there's this kind of complete disconnect between the language that the public uses and the language that the academics and researchers use. So researchers use these sort of annoyingly similar words like authoritarian parenting, authoritative parenting, and there's a huge literature behind that. But meanwhile, the public kind of hears about parenting in terms of objects and animals. So, you have helicopter parenting, tiger parenting, dolphin parenting, there's free range, there's attachment. So one of the things that I think clinicians really have to be able to do is sort of speak bilingually and try to apply what we've learned in the literature to the terms that they're hearing. Certainly there's a lot of evidence that shows that for a lot of kids, the authoritative approach seems to work best. That's the approach that combines a lot of warmth and support with good, reasonable limits. But again, there may be kids who temperamentally benefit from a little bit moving in a little bit one direction or another. And one of the things that I say in the book that might be a little bit controversial is, we've heard for years that parents should parent instinctively and parent naturally. That was sort of Dr. Spock's big theme. And I don't want to go against that, but I do think that parents sometimes need to pay attention and not parent in a way that becomes too natural for them. And at some points you need to move in a direction that may be a little non-instinctual. So by that I mean, if you're a parent that tends to be really kind of stern, and you kind of go to more to that old school style of parenting. Well, actually, maybe you're the kind of parent who needs to move to being a little warmer, a little bit more playful. If you're a parent who tends to be overprotective and maybe is anxious, you might really flock to that kind of more helicopter style. But in reality, what would help is to move maybe a little bit more in the free range direction and try to really promote independence. So there is a little section in the book where I talk about places where we might want to try to parent unnaturally in some instances.
But parents have temperaments too. And so I think, although that's intellectually a reasonable piece of advice, some people are just naturally warm, emotive, affectionate. Other people are naturally quiet and reserved. Other people are kind of cross all the time. I think there's a certain amount of, if my aunt had balls, she'd be my uncle, that if a parent could move flexibly between those kinds of things, that would be really great. But then it seems to me that you are asking somebody to do something that might be difficult for them. So I think it may be the first step in the parenting piece is to know yourself and to know what your temperament is and to know what your comfort zone is and where you might need a little help being adaptive to different situations. And at that point, maybe you're ready to sort of take on how to work that out with your child. What do you think?
Yeah, exactly. I think you said it better than I did, right? I mean, it's really hard to totally swim against your own temperamental currents. Mm-hmm. But I think being aware of what our traits are in places where they may work against us, and we might need to at least try to make some efforts in the other direction, I think are often well worth it.
Well, I think that's a really good note to end on. I think that we've really covered some important topics. I think your book has been is a very interesting read, and I will be interested in hearing a year from now whether you won your bet with your publishers or not. Thank you very much, Dr. David.
Yeah. Thanks for having me on. I really appreciate it.
And thank you to our audience as usual. See you next time. Thank you all very much for tuning in. This is Gay Carlson for AACAP's Screenside Chats.
AACAP provides Screenside chats as a member in public service, but it is neither a legal interpretation nor a statement of AACAP policy. Reference to any specific product or entity does not constitute an endorsement or recommendation by AACAP. The views expressed by guests are their own, and their participation in Screenside chats does not imply an endorsement of them or any entity they represent. Views and opinions expressed by guests are their own and do not necessarily reflect the views of AACAP or any of its officials.